let's look at a 3-shade technique. We're going to use 3 shades, A2, trans gray, and pearl neutral. Let me just throw a little little something at you, because it's actually a 4-shade technique, because I'm going to use my universal opaque shade, which I use under almost all of my anterior restorations. The reason being, this is opaque snow, by the way, and like I said, I use this under almost all of my anterior restorations, because it keeps the darkness from within the oral cavity from playing into the final shade of your composite. If you don't believe that that'll happen, have your patient put their tongue against their front teeth and you'll see the pink come through. And so it's the same thing with the darkness inside the mouth as it comes through your composite. It'll make your composite look gray or darker. So this is what I call my white canvas, and now I'm going to paint on it. So I've got it into place. Before I cure it, I'm going to cut it back, because this will stop that incisal translucency that we're actually looking for. So I want it to block out the darkness in the body, but on the incisal edge, we're going to go with something very fun here, very detailed here. All right, so notice how we've cut the composite. So we actually have these void spots in our opaque snow. So we'll take our Velo curing light. We're going to cure it for 10 seconds. And like so many of the newer composites, it's a photosensitive composite, which works to our advantage, because when we're doing deep restorations, say in a class 2 box, something along those lines, we don't have to worry about our composite not curing in those deep areas, because these respond very well to light. And what I do is I keep my overhead lamp on the patient's chin. So I've got good indirect lighting, but it's not directly on the tooth that I'm working on, so it doesn't gel up the composite. All right, here comes one of our fun shades. This is trans gray. This is probably a bit more than I need, but I can cut off what I don't need. So I'm going to take that, I'm going to put it into, or put it on this incisal edge, and it's going to fill those voids that we cut in the opaque snow. So this is fun. Just a little tiny bit goes a long way. So we're going to thin it. We're going to cut it, cut the excess off right in there, like so. And then we're going to cure that. Oh, still got a little void there. And that's okay. If you leave voids, even in your trans gray, what's going to happen is your pearl neutral is going to go in there and fill in that area. So it just gives you more dimension. So we'll cure for 10 seconds. And now let's come in with just a universal dentin shade. I think it's everybody's favorite, isn't it? Of course, in my practice, we bleach everybody for free, so it's not very often that I'm actually pulling out my A2 composite. But for those of you who are not bleaching all of your patients, you're probably still using quite a bit of it. So let's take that A2. Let's put it right here at the gingival third, right up against our handle. And then we want to push it around in the mold. And we want to do more pulling and pushing rather than that up and down padding that we may have been accustomed to doing in the past. Because what happens when you do the up and down padding motion is it starts working air into your composite. And then when you go to cure it, you've got these tiny little air voids that you're having to deal with. And that's a waste of time. And as we know in practice, time is money, right? So we want to get it right the first time around. So let's smooth that out a bit up there. Push that on back up there, fill in that little gap. There we go. All right, now let's smooth it in the center. And again, just more of a pulling action than anything else. And then again, I'm going to create these irregularities in my dentin layer so that my pearl frost will come right into this area here. And we're going to see a lot of fun optical dimension in this restoration. Okay, so let's go ahead and cure that. Now let's take our enamel shade. This is our pearl neutral. And remember, this is one of the workhorse enamel shades. It has a slight bit of warmth to it, very chameleon-like. So if I don't want to change the final shade of my restoration, if I place pearl neutral on top of it, it's still going to be the shade basically that I started out with, but we're going to have more translucency on the facial surface of the tooth like a natural tooth does. And that's what we want. We want great optical dimension without having to jump through a lot of hoops to get it. So this is a very predictable method. It's going to give us the detail that we want when we're looking at that tooth insofar as depth goes. It's also going to create a polychromatic effect because on the gingival 1/3, it's going to be very thin. Just move that around a bit. And if you find that you're wanting to smooth it out faster, or maybe there's a bit of sculpture in there that you're trying to actually work out of the composite, you can take a drop of the wetting resin with a clean gloved finger, nothing like a alcohol 2x2. Get your gloves clean. And you can actually go in there and smooth it like this. Very simple technique. It also pulls from the gingival all that excess enamel shade. And then we can just cut off the excess like so. Oop, left a little bit behind there. So let's get that off of there. Nice thing about working with a mold is that we can pop that out. We can also use our handpiece. But I want this to be pretty seamless, and so that when we take it out, we don't have a whole lot of adjusting to do on it. Okay, so let's go ahead. Let me smooth it out right there. Just bring that down further. All right, let's cure that. And then when we pull it out of the mold, we'll cure the lingual for another 10 seconds because it's still going to be tacky. That was a big chunk of composite we used to create our handle with. So we're just going to flip it over, give it another 10 seconds, and then we'll get our handpiece, our high-speed handpiece, using the finishing burr. We'll go in there and remove all the flash from around our project. And we'll also put in some very basic anatomy. So when you're doing this in your lab, playing around with the composites, because that's the best way to learn any system, is when the patients aren't there, get one of these molds and start playing around with 1, 2, 3 or more shades. See what you like about it, see which technique works best for you, and also compare it to your shade tabs to see, is it giving you consistently what you expect it to do, so that when you go to the patient, you know what to expect from your composite. Okay, so there's our first step in the polishing technique. So we're going to use the simplified polishing technique this time, and we're going to go in there with our Jiffy brush. So finishing burr to Jiffy brush, and watch how this tooth comes alive. You're going to see the shine with very little effort. This Jiffy brush already has the polishing agent in the bristles, so we're not having to use any messy paste or anything like that. We don't even have to use water. The main thing to remember is that with any rotary instrument, you can create some friction. So what I like to do is more of a light touch and high RPMs, and that way nothing gets hot. Also, having the assistant use the high volume suction while you're doing this cools things down tremendously. Alright, so that's pretty snazzy for something that was done in such a short period of time. Let's put that against a black background, because I think you get an idea of how shiny it is, and you're starting to see the beauty of those translucent shades. But look at that. Now that is beautiful. Not only do we see the beautiful translucency that trans gray gave us, but look at the white line. And we didn't have to do anything extra to get that.